All right, welcome back. It's been a long time. So today I'm going to be talking about bone fractures and repair. What are fractures? Fractures are breaks in bones, not in tissues, not in organs, not in anywhere else. We use that term specifically for a break in a bone. And the causes varies whether it's going to be in a younger person or in an older person. If it occurs in the young person, which we consider to be youth, the cause is usually going to be due to trauma and trauma from skateboarding injury, jumping, on a trampoline, something traumatic. While in the elderly, the cause is usually going to be due to bone thinning. So an example would be, grandma had a fracture of her femur, of her thigh bone. Most of the time it's not going to be due to trauma. It's due to bone thinning, which is the most common cause is osteoporosis. I'm going to be talking about osteoporosis in another video. So the bone is too thin, and we usually classify fractures in certain terms, such as the position of the ends after the fracture. Is there a completeness of the break? Is it broken a little bit at the edge, or is it broken all the way through? Is there skin penetration? Can you literally see a bone sticking out from the skin? Or, sometimes you may see underneath the skin. Is it simple or closed? And we use the term compound or incomplete or open. So when a fracture is closed, this is usually due to breaks, but the skin remains intact. All right, so we call this a simple fracture. And when it's open, there's a fracture, but it protrudes through the skin, and there's increased risk of osteomyelitis. So later on, down the line, we're going to be talking about certain infections like osteomyelitis. Obviously, you see the word osteo. There's going to be infection because now there's skin penetration, and we usually call this compound fracture. And when there is a complete break, then we say that the fracture involves the entire width of the bone. So it's broken through and through. If you remember what I said in the previous slide, broken through and through. And then we have certain other fractures like green stick fracture. I'm going to be talking about green stick fracture. I have another slide where I'm going to be talking about it. Comminuted fracture. This is when the bone fragments into many pieces, and this is usually common in people with brittle bones, like patients with osteogenesis imperfecta. That's a genetic disorder that is associated with bones. It's usually diagnosed really early on in childhood. A 3-year-old just rolled off the couch and fell and has multiple broken bones. And sometimes, before we knew about this, we used to think that this was some sort of child abuse, because you're like, parents are saying, hey, little Johnny rolled off the couch and now has this many bone fractures. Impacted fracture, this is when the two ends of the bones are forced together, and this is also called a buccal fracture, and we often see this in children's arms and hip fractures. There's oblique fracture, telling you the fracture is in an oblique form, transverse, in a transverse format, and the right angle to the bones. Bone ends. A linear fracture, this occurs parallel to bone's axis. Displaced, so displaced and non-displaced. I also have an x-ray of this in the next slide. The broken ends of the bones move out of the correct anatomical alignment, and this is also called an unstable fracture, and this requires immediate attention because this could further cause damage. And when it comes to non-displaced, this means the broken ends remain aligned. So, knowing these also is very important, because this also has to do with treatment, how we are going to put the two bones together and align them. So in the place of non-displaced, it's already aligned, so we just have to make sure that the bone ends are meet together. And stress fracture might be one of the most common ones, because this is usually caused by small repetitive forces on the bone, and it's caused by participation in sports or exercise, tennis, or it might just be you walking, walking, and there might be stress fractures. And this is unique because it's not usually picked up by X-ray. So this can go undiagnosed until patients keep coming back and say, I think there's something wrong. Spiral fracture will go in a spiral format around the bone, and this usually occurs as a twisting force. And this could, often a sports injury, trying to, basketball players twisting, getting away from their opponents. This could be a twist and fracture, but this can also occur in children. Depression fracture. This is when the bone is forced inward, and this can occur in skull injuries, as you can see. Pathologic fractures. This is when, the word patho means disease. This weakens the bones. This is due to osteoporosis, bone cancer, osteogenesis imperfecta. And then there is a compression fracture, which is when the bone is crushed. And this most often occur in the vertebrae, most commonly seen in people with osteoporosis. And in youth, if we see this in youth, this is when, the youth underestimate how deep the pool is and dove head first into the pool, and we're going to see a compression fracture, not just a skull fracture. So we can see some of these, what they would look like on X-ray. We see the transverse fracture, again, a break along the axis. The displaced fracture, you can see that the bone ends are not meeting. You need to put the bone ends together in order for healing to occur. This will produce new and abnormal bone arrangements. You can see the compression fracture here. This is seen in the vertebra, the vertebral columns. And you can kind of see the spiral fracture, like I mentioned, produced by twisting stresses. Epiphyseal fracture. This is the bone matrix is undergoing calcification and chondrocytes are dying. And we tend to see epiphyseal fracture in children because why? They are still growing. Their epiphyseal, you can see the epiphyseal line here, it has not yet fused, and this allows the bone to grow longer. So if you have not seen the video prior to this, I discussed chondrocytes there. Chondrocytes are cartilage cells and they are not bone, and anytime you see that, this tells you that the person is still growing. And then we can see the comminuted fracture, which is the affected area is shattered into multiple pieces. And then we see the green stick a little bit. Again, you have to pay very close attention to this when you're looking at the X-ray, because again, this is one of those that can be easily missed. And then you see a distal radius or ulnar fracture in the Colles fracture. And this usually occurs when someone's about to fall. And what do you do? Reflex. You just stretch out your hand to prevent that fall, and as a result, this can result in fracture of your radius and your ulna, which are your two forearm bones. And then the pons fracture will be synonymous to the Colles fracture, but this will occur in the leg region. So this will be fracture at the ankle region, the distal end of the tibia and fibula, which are again the two bones that you see in the legs. So this is a close-up picture of the pons fracture. And we can also call this a bimalleolar fracture, which means that it affects the medial malleolus. After this video, I'm going to be talking about exoskeleton. So if you don't know some of these the names of these bones, you can always go back and watch this video and review the names of the bones. But the medial malleolus is the part of the bone on your ankle that sticks out. That's a malleolus, and it's medial. Again, medial means midline, towards the middle. If you haven't seen my video on anatomical structures, so go back and look at that. So we can see this on the medial malleolus of the distal tibia and the lateral malleolus of the distal fibula. Pons fracture is actually also very common in sports like soccer. The fibula is a very thin bone, so if someone hits on the side of the shin, this bone is going to get fractured most of the time because it's a very thin bone, and it's very pliable, very thin, so it can get fractured easily. So this is a close-up view of the green stick fracture. So with the fracture of the radius, only one side of the shaft is seen, is broken, and the other side is bent. So the radius, the bone of the radius, this is the bone that kind of goes along your thumb region, and then the ulna would be by the pinky. Again, I'm going to be talking about the axial skeleton, and this often occurs in children because their bones are not yet fused. And one of the things also that there's a reason why we tend to see a lot of fracture in children. When I mean children, not babies like 5-year-old, but in sports, so 16, 17-year-old, is because their bones still growing and it has not calcified yet, and it's just more susceptible to fractures. So for Colles fracture, you can see here there's a break in the distal portion of the radius. I mentioned, reaching out to cushion a fall. And this is going to be very close to the wrist region. So this is going to be the radius. It could also be the ulna, but it's the radius. And another thing that also gets fractured here is one of the wrist bone called the scaphoid bone. It also gets fractured easily in Colles fracture, depending on the amount of force affecting this fracture. So that's another one to consider. So fracture treatments and repair, there are 4 stages. And the first stage is going to be hematoma. All right, hematoma and hematoma formation, fibrocartilaginous callus formation, bony callus formation, and bone remodeling. So once a bone is fractured, the repair proceeds in a predictable pattern. So the first step, this occurs 6 to 8 hours after injury, and this is the formation of the fracture hematoma as a result of the blood vessels breaking in the periosteum and in the osteons. So we see this this is the hematoma formation. Hematoma, you see the blood clotting. All right, you see the blood clotting. These are torn blood vessels hemorrhaging, forming a mass of clotted blood. That's a definition of a hematoma. And you can see that the site is swollen. It's going to be painful. It's going to be inflamed. It's going to feel warm. It's going to be because of that blood in there, and it's going to be swollen, inflamed. And the second step is the fibrocartilaginous callus formation. Here we see the capillaries growing into the hematoma. The phagocytic cells, which are the ones that are going to clear all the debris, good or bad. Any broken bones, we have certain cells, yes, that do that. Fibroblasts are a type of cells that are going to secrete collagen fibers. Collagen is what makes bone. We see this in connective tissue. If you haven't seen my video of connective tissue, go and take a look at that. So they're going to secrete collagen fibers to span the break and connect the broken ends. So we're also going to see cartilage. So if you remember, again, a video prior to this, how is bone made? Bone is first, the model is going to be cartilage. It doesn't mean, we're not saying that cartilage becomes bone, all right? Cartilage is like orange, apples and oranges. Apple would never become an orange, and orange would never become an apple. So, but most people think cartilage becomes bone. No, cartilage is replaced by bone. So since we're looking at a limb here, which is the model is we had cartilage as a model. It's no surprise that we're going to have a cartilage here again, right? Endochondral ossification. So we're also going to have osteogenic cells. Osteogenic cells are going to be the ones that are like the stem cells of bones. So it's no surprise that, we're going to see them beginning the reconstruction. And this creates a cartilage matrix of repair tissue, osteoblasts. If you, again, go back to the previous video, osteoblasts are bone building cells. Perfect here. They are especially needed here, and they're going to form the spongy bone within the matrix. So we call this repair tissue fibrocartilaginous callus. All right. So for the bony callus, this happens within a week. So you start to see changes. All right, we see new trabeculi. The trabeculi are what we see in spongy bone. All right, if you remember in the previous slide, I mentioned spongy bone is laid down first. And even in places where there are compact bones, we're going to see spongy bone. I'm going to be talking about the histology of bone tissue after this video. And we see that the callus is converted to bony or hard callus of spongy bone. This will continue for about 2 months until firm union forms. And bone remodeling is the last step. So this is going to continue for several months. It doesn't mean that the individual would not be able to walk, move, but we just have to let them know that, hey, you're still undergoing repair. And any excess material, kind of like dust it, clean that area up on the diaphysis. The diaphysis is the shaft, and the medullary cavity is removed. And compact bone, which we see, compact bone is a smooth, solid, shiny portion. It's laid down to reconstruct the shaft walls, and the final structure resembles original structure, responding to same mechanical stressors. What do we mean? Responding to the same mechanical stressors. This is where therapy, physical therapy, comes into play. What were you doing before? If you were an athlete, we want you to start doing that. We want this bone to be the same way it was, to function the same way it was. So we have to stress it. We have to make it respond to the same mechanical stressors. And this is just a quick summary of all the stages in the healing of fractures. This is going to take months, but the individual does not have to homebound or be on crutches. Usually when it gets to the third stage, they can start moving around. And by the way, I also forgot to mention physical therapy starts immediately, because if you don't use bone, it will die, called atrophy. So sometimes there's a knock on the door, physical therapy is there, and you're like, wait, what? Did you not know that I had a fracture? Yes, but they have to start the bone responding to stressors, or else by the time you wait months, you would not be able to use that bone. So this is very, very important. All right, so that's going to be the end of bone fracture and repairs. All right, thank you. Bye-bye.